Hi everyone and welcome. Today another episode of an amazing innovation with AI. Let me know in the chat where you're from today. I'm broadcasting from the Netherlands and we're live on more than 5 different social channels. So once again, welcome. Today we're going to do a deep dive in how AI is applied in healthcare. And at the beginning, we already showed some kind of sneak preview, but if you missed it, don't worry. Because we're going to do a deep dive and we're going to show you more details again. If your company has an innovation as well that they want to share, contact me via one of my social channels. You can direct message me and see if we can share your amazing innovation here on my channels as well. So let's get started. Welcome to the intelligent world. Today we're going to do a deep dive in how AI is applied in healthcare. So special thanks to MIT CSAIL for sharing their research, which we're using for this broadcast. I think it's amazing to think that AI algorithms, they are used in healthcare to determine if a patient is ready for its chemotherapy, or whether it needs to be moved to the intensive care unit, or dictate the triage of patients. But are we ready as a society to truly embrace AI and use it to administer this high level of patient care? Now, let's play the full video of how AI is applied in healthcare, and after that we can deep dive into more details. Let's play the video. Quite amazing, isn't it? So a variety of public and private data sources, they are used to create these AI algorithms, like those used in healthcare for the example that we just showed. And people think that these algorithms, they are looking at data points like lab results or vital signs to determine their outcomes. But scientists, they are discovering that it's possible that algorithms are also looking at race, at ethnicity, or at sex. And the data that's fed into these algorithms is mirroring unconscious human thoughts of racism, of prejudice and bias. And this study, this underlines on one of the most important and most necessary considerations when developing AI models, and that's ethical AI. So do we, as a society, truly understand the impact of AI models that we create and that we are really ready for it? That's, I think, an important question. So let me ask a question to you. So is the world ready for this impact of AI in healthcare? Are you ready for it? Let me know in your chat. Let me know your thoughts, and we come back to that later. So okay, so some of you might be thinking that the data is the problem. So why don't you just remove some sensitive data? If you remove the sensitive data, then the algorithms will be more ethical, you would expect. And in fact, you're not wrong. But what happens when this doesn't work? So to put it a little bit into perspective. So research teams, they looked at, for example, X-rays and CT scans and mammograms and other medical type of images. And then they trained a deep learning model to identify race using data from medical images without specifically mentioning the race at all. So scientists, they look closer to these type of AI models, and they discovered that sure enough, AI can accurately predict race from just medical images alone. So to keep in mind, this is something that top medical experts can't determine by just looking at these medical images. So AI is more advanced than, let's say, the human in this case. So how do we figure out what's going on? So to investigate why these algorithms are able to detect race, they check the anatomy, the bone density, and the high resolution images, and many more factors. But despite looking at so many different variables, researchers still could not come up with an accurate type of answer. Now, to check this out, because it gets even more complex. Even if the images are filtered out of the completely unrecognizable, these deep learning models still were able to highly accurate define what race it was. So in fact, the models could predict race just from diagnostic labels. And this is quite staggering. This is a key point here, because these AI algorithms are using some kind of, let's say, superhuman capabilities, and it makes it much, much more challenging to control and to regulate and to prevent from harming people. And this deep learning model is truly an amazing innovation, because it sheds some light on AI inequities and on disparities that are unconsciously mirrored in the data and in the AI algorithms that are being used in clinical healthcare. So we should pause and we should reconsider whether we are not ready to bring AI into the world in this capacity. I have another question, and let me get back first to some answers. We see Jakub in, we see Vicky from Greece. Good to have you here. And Vicky says, I like AI in healthcare. Ethical people can build ethical software, right? Yeah, it's, let's say, right in a sense where the AI is capable of detecting more than what, let's say, the humans can do. And we see Bree in it. Bree Willis, welcome. We see race has no scientific basis as it's a social construct. So what are the parameters of race in this context? So the differences in the images from the lung structure, from the bone structure, based upon these characteristics, the AI could detect what type of race and what type of background these people have. Then we have Vicky again. She says racism is a part of a bone marrow. And then we have Pankai. Thanks for imparting the knowledge with us all. Yeah, you're welcome. Let me ask you the next question. What do you think of the impacts of this profound study from MIT? Let me know your thoughts in the comments as well. I think it's quite amazing, and it gives us a better insights in what AI is capable of. Give me your comments, and then we will dive deeper into it during the chat. So let's see the input from the different type of questions and see if we have more comments. Not for now. So it's a short broadcast. I would like to thank everyone for joining us to talk about these really important topics, AI in healthcare, and see where we can, let's say, remove the bias as much as possible. And be sure to continue the conversation with us in our chat and on our channel. If you or your company has an amazing innovation to share, just ping me, DM me on one of my social channels. Thanks for now. This is The Intelligent World. I'm looking forward to seeing you next time.